Welcome. I am Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I will focus on the articles that our Editor-in-Chief, Dr. William Lanier, has selected as Editor's Choice and Highlights for the February 2014 issue of our journal. This month's Editor's Choice is the original article, Pre-Hospital Use of Inhaled Corticosteroids and Point Prevalence of Pneumonia at the Time of Hospital Admission, Secondary Analysis of a Multi-Center Cohort Study by Dr. Emir Festic and colleagues from the Mayo Clinic campuses in Florida and Minnesota. The authors found that after adjusting for multiple confounding variables, inhaled corticosteroid use was not associated with an increased risk of pneumonia requiring hospitalization. The accompanying editorial, Pneumonia Associated with Inhaled Corticosteroid Use in Chronic Obstructive Pulmonary Disease, Another Perspective, was authored by Dr. Paul Scanlon from Mayo Clinic in Rochester, Minnesota. The author puts into context how the use of inhaled corticosteroids to treat chronic obstructive pulmonary disease has been challenged, in part because of concerns for both efficacy and safety. One of this month's featured highlights is the original article, Stroke Risk and Outcomes in Patients with Traumatic Brain Injury, 2 nationwide studies, by Dr. Chien-Chang Liao from Taipei Medical University in Taipei, Taiwan, and colleagues from several other Taiwanese healthcare institutions. This retrospective cohort study found that traumatic brain injury was associated with risk of stroke and post-stroke mortality. The accompanying editorial, Traumatic Brain Injury and Stroke, was written by Dr. James Meskia from Mayo Clinic in Jacksonville, Florida. Dr. Meskia is our section editor for neurology. Dr. Meskia elaborates on how a deeper understanding of the mechanisms that underlie the association between traumatic brain injury and subsequent stroke might lead to novel ways to prevent stroke. The other featured highlight in this month's issue is the solicited review article, Multiple Sclerosis, Current and Emerging Disease-Modifying Therapies and Treatment Strategies, by Dr. Dean Wingerchuk and Jonathan Carter from Mayo Clinic in Scottsdale, Arizona. The authors discuss 10 current therapies that have convincingly altered the short and intermediate-term natural history of multiple sclerosis and highlight some more new therapeutic options that are poised to do the same. And just to remind you again, in 2014, Mayo Clinic will be celebrating 150 years of patient-centered care since Dr. William Worrell Mayo opened a practice in Rochester, Minnesota in 1864. As part of this sesquicentennial celebration, Mayo Clinic Proceedings will feature a number of articles that highlight our accomplishments in patient care, education, and research. This month's sesquicentennial feature is the article, The Enduring Culture of Mayo Clinic by Drs. Leonard Berry from Texas A&M University and Dr. Kent Zeltman, who is the Emeritus Chair of the Marketing Division at Mayo Clinic in Rochester, Minnesota. Our new online-only Mayo Clinic Proceedings Legacy section will feature Dr. Edwin Baird, Mayo Clinic Proceedings' first Editor-in-Chief, and show some notes on a historic proceedings article from the late 1940s on Compound E and the discovery of cortisone. This month's contribution to our ongoing Symposium on Regenerative Medicine, entitled Emerging Medical Devices for Minimally Invasive Cell Therapy, was authored by Dr. A.A. No-Carp-Hill and colleagues from the Brigham and Women's Hospital, the Harvard Stem Cell Institute, and the Massachusetts Institute of Technology in Boston and Cambridge, Massachusetts. This article provides teaching exercises for which you can receive up to 1 hour of CME credit if you complete the appropriate documentation. Also featured on the cover page of our February 2014 print issue are the following articles. The special article, The Rising Incidence of Young Onset Colorectal Cancer, A Call to Action, by Dr. Dennis Anand from the University of Colorado School of Medicine in Denver, Colorado, and colleagues from several other national healthcare institutions, and the review article Management of Hepatic Encephalopathy in the Hospital that was authored by Dr. Michael Lizey and colleagues from Mayo Clinic in Rochester, Minnesota. Video interviews are available with authors of most of the articles mentioned in this recording and some others as well. These interviews can be found on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. Check out our new interactive Path to Patient feature, which is curated by my associate editor colleague Dr. Lori Erickson from the Department of Laboratory Medicine and Pathology at Mayo Clinic. Also on the website, our series entitled Editorial Board and Staff this month features Dr. Gary Schwartz from Mayo Clinic in Minnesota, who has been our section editor for nephrology and hypertension since 2006. Dr. William Lanier, editor-in-chief of Mayo Clinic Proceedings, the entire editorial board and I sincerely hope that you will enjoy these and the other fine articles in the February 2014 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. As a preview, the next issue of Mayo Clinic Proceedings, which will go live on our website on March 3rd, 2014, will contain articles entitled Contamination of Stethoscopes in Physicians' Hands Following a Physical Examination, a pooled analysis of waist circumference and mortality in 650,000 adults, and my treatment approach to the management of the pregnant inflammatory bowel disease patient. In the meantime, you can watch videos related to our journal content on our YouTube channel. You can also follow us on Twitter and like us on Facebook to stay up to date on online first publications and on breaking news related to our journal. Direct links to our YouTube, Facebook, and Twitter presences can be found in the upper right-hand corner of our homepage. Recording on reportedly the coldest day ever in Minnesota history, I bid you goodbye until next time.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.